So can you imagine if you're driving a car and you step on the brake and the car actually accelerates? That's what happens in FOP. And that's what the gene does. That's what the gene mutation does. It turns a brake pedal into an accelerator pedal. And it sends a signal inside the cell to make more bone so that when you injure your muscle, you regenerate your muscle, you heal your muscle. We all have the experience of going out and playing, playing baseball or playing ball or doing something, and we ache a little bit the next day. And that's inflammation in the muscle. And the normal gene that everybody should have sends a signal not to make bone there, but to repair the muscle. And FOP, that inflammation that triggers putting your on the brake pedal, actually is an accelerator pedal and stimulates the body to form more bone. And that's basically what it is.
Hello and welcome to Cure Talks. I'm your host Priya, and today we are diving into the world of Fibrodysplasia Ossificans Progressiva, or FOP, a rare genetic disorder that causes soft tissues like muscles, ligaments, and tendons to transform into bone. Imagine living with a condition where even a small injury could lead to the formation of new restrictive bone. It's a life altering diagnosis, but incredible work is being done to understand, manage, and support those living with FOP. To help us explore this complex condition, we are honored to have two leading experts from the University of Pennsylvania with us. Dr. Frederick Kaplan, one of the world's foremost authorities on FOP and a pioneer in rare bone disease research, and Dr. Mona Al-Mukaddam, a specialist in the clinical care of patients with FOP and a passionate advocate for improving their quality of life. We are also thrilled to be joined by Whitney Weldon, who lives with FOP. She works tirelessly to raise awareness about the condition. We'll be hearing Whitney's story and insights about living with and navigating this condition. So welcome to Cure Talks, everyone. Let's start with the very basics. Dr. Kaplan, for our listeners who may not be familiar, could you briefly explain what FOP is and how it affects the body?
Sure. Thank you. Thank you very much. FOP is an extremely rare disease, one of the rarest diseases that affects human beings. It Children are born with almost no impairment whatsoever, except for a great toe malformation, which is a telltale sign of the condition. And about ages 2 to 5, painful swellings that look like tumors, often due to injury, but sometimes spontaneously occur on the back and transform slowly into bone. FOP is basically a condition where the muscles, tendons, ligaments, and soft connective tissue of the body progressively turns to bone, and it starts in childhood. And by the time children are in their teens or 20s, a second skeleton is already forming that immobilizes the joints of the body. And fairly soon, there's no mobility left at all. Basically, FOP creates a second skeleton out of the body's soft connective tissue. And the battleground for FOP is really childhood. Prevention is really the key. And children who have FOP and people who have FOP are battling, constantly battling conditions where trauma, injury causes soft connective tissues to turn into bone. Even though it's a rare condition, there are many, many common conditions where extra bone forms, like in hip replacements, head injuries, spinal cord injuries, even in atherosclerosis, hardening of the arteries, and in calcification of the heart valves. And so the keys to the closet, the keys to understanding FOP, are really the keys to the kingdom to understanding many, many more common conditions of heterotopic bone formation as well.
That sounds incredibly challenging. Dr. Al Mukaddam, Dr. Kaplan just explained some of the early signs and symptoms. Can you talk a little bit on why it is often misdiagnosed in children?
Yeah. So I think, just kind of echo a lot of things what Fred was talking
Mhm.
about the malformed big toes and
Yeah.
how, this is really most of our patients who have the classic FOP will be born with this malformed big toe. Now, of course, not every child that's born with this malformed big toe, which is, a toe that's shorter, it's bent, and it's missing a joint, but not every child that's born with a malformed big toe will have FOP. And, during the first decade of their life is when they start getting these painful, lumps and bumps and it usually starts in the head or in the back or in the shoulders for children. And so when a doctor comes and when a patient comes, when a child comes to a doctor and they have a swelling in their back or in their neck, they're not going to think to look at the toe, right? So that's one issue as well, is how it presents in the childhood. And also because it's such a rare disease, we know of about 1,000 patients around the world who have this disease. So there's a lot of doctors and physicians and providers that really are not aware of FOP. And so they really miss the diagnosis. And a lot of our patients who are coming in with these lumps and bumps, you always worry about something really scary. And so you don't want to miss something serious like a cancer. And so a lot of our patients undergo unnecessary and harmful procedures. But I think we're doing a better job, I have to say. Like just in the past couple of years, I got one call on a landline, not like anyone ever uses landlines anymore, but I did get a call on a landline from an oncologist saying, I have this child who's referred to me for a second opinion for cancer, but I heard Dr. Kaplan's talk and I think he
Mhm.
has FOP.
Oh, wow.
And then another radiologist who happened to also hear about FOP was scanning a child recently and noticed the toes and said, oh, I think this child has FOP. And so I think we're doing a better job,
Mhm.
yet there's still a lot of patients who are undiagnosed and unfortunately getting unnecessary and harmful procedures.
Mhm. We know FOP is caused by a mutation in the ACVR1 gene. Dr. Kaplan, could you walk us through how this gene mutation leads to abnormal bone growth?
Yes, it's quite amazing that everybody who has the classic form of FOP, which is about 97% of those 1,000 people in the world that Dr. Al-Makadam said have FOP, and we've seen most of them. Um, all of them have, all of those patients have a single letter misspelled, and that single letter in that gene, that it's called ACVR1, the gene makes a protein, and that protein is a receptor. It sits on the cell membrane, and it gets signals from outside, and it sends signals inside the cell. And basically, that single change in the structure of the protein in the gene and then in the structure of the protein that's encoded by that gene causes a brake pedal to turn into a gas pedal. So can you imagine if you're driving a car and you step on the brake and the car actually accelerates? That's what happens in FOP. And that's what the gene does. That's what the gene mutation does. It turns a brake pedal into an accelerator pedal, and it sends a signal inside the cell to make more bone. So that signal is there so that when you injure your muscle, you regenerate your muscle, you heal your muscle. We all have the experience of going out and playing, playing baseball or playing ball or doing something, and we ache a little bit the next day. And that's inflammation in the muscle. And the normal gene that everybody should have sends a signal not to make bone there, but to repair the muscle. And FOP, that inflammation that triggers putting your foot on the brake pedal, actually is an accelerator pedal and stimulates the body to form more bone. And that's basically what it is.
Living with FOP must bring a lot of unique challenges. We are honored to have Whitney Weldon with us today to share her personal experiences. Whitney, could you tell us a bit about your journey with FOP? How did you first receive your diagnosis, and what were some of the challenges that you faced?
Yes, I was 9 years old. It is 24 years ago in April, and I was in gym class. When you're
Mhm.
younger, you really participate in all the variety of sports. And I remember it was a Thursday before spring break. We were doing basketball, and I flicked my neck back, and I heard a crack. And then about a week later, my family and I are in Colorado on spring break, and all these bumps started forming on my back. And immediately we went back to New Jersey and we went to the hospital. And I was fortunate enough that the doctor was like, I actually think you might have FOP. You need to go down to the University of Pennsylvania to meet with this great doctor, Fred Kaplan. And that happened, and I was officially diagnosed with FOP. And at that time, I was no longer able to participate in active sports, team things. I had to sit out during recess and just observe. And being a young child with these limitations and nothing's wrong with you yet is very hard, very challenging. And I have since over the years have now transitioned into using a wheelchair full time. That started in about 2011, and that was a huge hurdle for me to jump because I was
Mhm.
so active in high school, and then slowly my parents were like, if you want to do what everyone does and go to college, you need to be able to get around safely, and a wheelchair is the way to do it. And I'd love to say now that I don't know where I'd be without my wheelchair. It keeps me active, engaged in the community. I can do things because if I didn't have my wheelchair, I am no longer able to do things. I can't sit in a standard chair. I have lost full mobility walking up and down stairs. I walk very few steps in my apartment, but other
Mhm.
than that, you will always see me in my chair. And it's given me so much life to be able to explore the world. And despite all the challenges that it brought when I first started in 2011, it's really opened my eyes to being able to be the best person with or without a rare disease.
Oh, Whitney, that's so incredibly inspiring. So much positivity. I'm sure our listeners would certainly love, would know to have heard this from you. Uh, I can't even imagine that, how it would be, but amazing, amazing, Whitney. Can you talk a little bit about how you manage it? Of course, you did mention wheelchair for movement. Is there any other treatments that you're on to manage your condition better? And how is it support from the research and medical team helping you?
Yes, so about that was 24 years ago I was diagnosed, and
Mhm.
so much has happened between then and now. It is truly incredible. And I have been participating in a trial since 2018,
Mhm.
and it recently got approved from the US FDA, and it slows down bone growth. It doesn't stop it,
Okay.
but it's a stepping stone. And I give great credit to my experience with the drug because I think it has kept me stable. And I also have great relationships with the medical team. Both Dr. Al Mukaddam and Dr. Kaplan are always there for me if I have any questions, if I'm scared. And they're just remarkable. And to be able to be amongst wonderful people who dedicate their lives to helping such a small community with a rare disease that not many people hear about is truly incredible.
Thank you, Whitney. Thanks for sharing that. Just to move on to some of the advancements in FOP research, Dr. Al Mukaddam, can you share any recent breakthroughs, probably the FDA-approved drug that is on trial and Whitney is part of for, and any other drugs that are on the in the pipeline for FOP right
Yeah.
now?
Yeah, no, I want to thank Whitney as well for joining us today and for
Yes,
everything that she has said,
absolutely.
because I think, Dr. Kaplan would say the same thing. I mean, he's been doing this for so much longer than I have, but I think this is a two-way relationship, and they bring so much to our life as well, and we learn so much from them. And so I think this has just been really wonderful, and we really thank Whitney and her family and the whole FOP community, honestly, for allowing us to be involved in their lives, to be very honest. And but going back to your question about, breakthroughs,
Mhm.
um, I joined the FOP community in 2016, so I'm just kind of reaping the fruit of all of their hard work. So it's really hard for me to kind of highlight all the remarkable work that my colleagues have done. But I think there's a couple of life-changing breakthroughs that have happened. And of course, in 2006, with Dr. Frederick Kaplan and Dr. Eileen Shore identifying the gene
Yes.
responsible for FOP, really changed the whole landscape of how we think of FOP and allowed us to really understand the brakes system that Dr. Kaplan was referring to. So I think that's really one of the major breakthrough that really has led us to where we are right now. The other major breakthrough is also the role of activin A in FOP, like
Mhm.
Dr. Kaplan was alluding to, where in normal individuals, activin A should turn off that receptor. But in our FOP patients, that activin A actually further amplifies this receptor and causes it to form more bone. And I think the other major breakthrough that recently happened was, Dr. Fred Kaplan's astute eye at, seeing this patient that we had who was
Mhm.
resilient, who had the classic FOP
Yeah.
variant, but very little bone formation. And that allowed us also to understand the role of MMP9 in FOP, and now the development of an antibody to block MMP9 in the hope that it would actually provide any treatment. So there's been so many breakthroughs. I think I just highlighted ones that I feel have been extremely impactful.
Mhm. Mhm.
Uh, um,
And
but yeah,
Dr.
I think those are.
Yeah, Dr. Kaplan, if you could also add onto what we are looking forward to in terms of research for in FOP.
Sure. I think beyond everything we've said, the bone that forms in FOP is normal bone. It's
Yeah.
normal bone, but it's just in an abnormal location. So the heart doesn't turn into the brain, the kidneys don't turn into the lungs. But here, muscle and tendon and ligament turn into bone. So one tissue turns into another tissue. So it's kind of an amazing thing. And as Dr. Al-Mukaddam said, when we discovered the gene, the entire pathway became clear almost immediately. People had been working on this pathway, but they had no idea that it was associated with FOP. And so the discovery of this pathway gave us many, many targets to aim at, and each of those targets is a possibility for therapy. And like Whitney said, the first drug has been approved, but now there are 3 clinical trials that are based solely on the gene discovery. So those drugs that we're now testing are those drugs are meant to shut down that abnormal brake pedal that's an accelerator pedal, and hopefully we'll be able to gain um, some more benefit in shutting down bone formation. Um, it's sort of like, maybe 300, 400, 500 years ago when the explorers sailed around the world and they drew maps of the continents. We can look at those maps and we can say, oh, the broad outlines of the continents. I can see North America, I can see Africa, I can see Europe, but they're not very clear. That's where we are now, but hopefully we have the ability in the coming years to fill in that map. And that's where I think research will make some great strides. And I think all of what we said, what Whitney said, what Dr. Al-Makadam said, the stage for FOP is really in childhood. And so the name of the game, I think, is really prevention. If we can prevent the bone from forming safely and efficiently, um, then maybe we'll make some strides where we can prevent problems from occurring. When prevention is done absolutely right, absolutely nothing happens, and everybody will benefit from that. Not just FOP patients, but patients, hundreds of thousands of patients that have more common conditions of extra bone formation.
Dr. Kaplan, I'm going to actually go a little bit out of script here. I have you and here on Cure Talks, and I really, really need to ask you this. I was reading up about how you got interested in FOP, having seen a patient, I think, many years back. Can you share that story? Because I think that was a turning point, I feel, where we've had some change and there's been research, right? Can you go back to those years and, share that story?
Yes, I had seen two adults who had FOP. I was very interested. Trained as an orthopedic doctor, orthopedic surgeon, and I was very interested in disorders, people that had disorders that affected the entire skeleton, not just the hips or the knees or the ankles or the hands, but everything. And so I had seen two adults, and most adults like Whitney are very well-adjusted people. You know, whether you have FOP or some other condition. But I had never seen a child. And I was over at Children's Hospital. I was seeing a child who had a different problem. And chief of genetics came over to me. I didn't know who he was at the time. And he said, you're the bone guy, aren't you? And I said, well, I'm a bone guy. I'm not the bone guy. I'm a bone guy. So he said, have you ever seen a child who has FOP? Do you know what FOP is? I said, yes, I do. I do know what FOP is. He said, well, maybe we should work together. I said, I'm not a researcher. I'm a clinician. He said, no, have you ever seen a child who has FOP? I said, no. He said, can you come next Wednesday? I want to introduce you to a child. And that day, that next Wednesday, I saw a child who had FOP. She was 2 years old. And she still had mobility, but I could see what could happen. I could see not just the what the disease did, but what the disease was doing. And she had lumps and bumps on her back and her neck, and she had stoop posture and decreased movement. And I said I had never seen anything so severe. I mean, in all my days. All my training, all my orthopedic training, I had never seen anything so catastrophic. And this surgeon said to me, can you come into my lab and we'll work on this together? Nobody in the world is working on this. And I said, I'm not a researcher. He said, listen, you teach me bones and I'll teach you molecules. And we did. And that was Dr. Michael Zasloff. And he had just come from the National Institutes of Health. I'd seen some FOP patients and was following them. And we started working on that. And that was 35 years ago, or almost 40 years ago. And that changed the direction of my career entirely.
Thank you so much, Dr. Kaplan, for sharing that. Dr. Al-Mukaddam, what role do organizations like IFOPA play in supporting patients and advancing research?
Yeah. So, of course, patient organizations like the International FOP Association, they play an instrumental role. I mean, they create a community for patients and caregivers to really learn and support each other. But they really also help us as physicians and researchers, as well as for pharmaceutical companies, to really better understand what the research questions need to be and what we should be asking. We have every other year a drug development forum where you have researchers, drug companies, physicians, as well as patients come in to really come and think about the problem from different aspects and different to think about it from different ways. I would like to also highlight two other organizations that I think are also very important. One is the International Clinical Council on FOP. So the website is iccfop.org. And this is an organization that Dr. Fred Kaplan and I are founding members of, but it's an organization that was established to really consolidate the global voice, to update the clinical care as well as clinical research for patients living with FOP. And so it's a group of international FOP experts that we meet on a regular basis to kind of update these guidelines. And then the other organization is Tin Soldiers, which is a patient finding organization. And so this is an organization that uses different platforms like documentaries, creating educational series, as well working on the ground to really try to identify patients living with FOP around the world, and then referring them to the International FOP Association, referring them to the ICC, connecting them with appropriate care. So I think all of these organizations really allow us to target the problem in multiple ways.
Thank you, Dr. Mukaddam. I think we will probably, share this video with Tin Soldiers. I think I've reached out to them for the show, so probably they are aware. So it'll reach the target people who should listen to this. Dr. Kaplan, for those listening today who want to support FOP patients or contribute to research efforts, what are some ways that they can help?
Well, it's unquestionable that you can't guess the cure to FOP. You have to do research, like Dr. Mukaddam said, and you have to be there to uncover the mysteries of FOP. So research has gotten us where we are, and Whitney said it so beautifully. Whitney and Whitney's family have helped us so much along the way. And other families as well. So we're very grateful for that. And research will bring us home. Research into the causes of FOP to really crystallize this map so it's a very clear map, and we can fill in the targets. We can fill in the targets for treatment. I mean, we couldn't have guessed. There's no way we could have guessed that matrix metalloprotease 9 would have fit in that diagram, would have helped us analyze that coastline and draw a better map. But it did, and that was because one patient was resilient, and is now 35 years old, has the same gene as Whitney, has that same problem with the brake pedal turning into the accelerator pedal, but he doesn't have any problems. He has full range of motion. And so something is protecting him. And we found out what that was. And we thought what it was. And then we took it back to the lab. And it took many, many years in the laboratory. And that's research. That's what research does. And so what is involved in research? It involves people doing that work. It involves scientists doing that work. And to support that, we'll support not just FOP, but many, many, many more common conditions. In the hardening of the arteries, you think, well, that's calcium in the arteries, calcium buildup. About 15% of that is bone formation. People that have heart valves that are calcified, you think that's calcium. About 15% of that is bone, just like FOP. People with FOP don't have those particular problems, but that is the answers to FOP will help people who have these more common problems. So as I said before, the keys to the closet of FOP are really the keys to the kingdom. And that the keys are stimulated by research. And I think people that contribute to the research contribute to research funding on rare bone diseases, on FOP in particular. And it's very interesting that before we discovered the gene, there was no interest by the pharmaceutical companies. Now there's 13 different pharmaceutical companies who are interested in FOP, and they are developing drugs for extra bone formation. It's very often that the rare diseases show us the common problems. Why? because nature doesn't invent new cells, new molecules, new pathways for common diseases. It's the rare ones that show us, that unveil, that lift up the lid and show us the highways that are used by common diseases as well. And that's all due to research.
Thank you, Dr. Kaplan. It is so important actually to raise awareness and support for rare diseases like FOP. Before we wrap up, Whitney, is there any final message you'd like to share with our listeners?
Yes, so thank you all for listening, and always believe there's hope, because that's how we get by every day. And I try to live my best life with FOP, and I don't let that stop me.
Thank you, Dr. Kaplan, Dr. Mukaddam, and our incredible Whitney for sharing your time, knowledge, and experiences with us today. It's been an interesting and eye-opening conversation about the realities of living with FOP and the tireless efforts being made to treat and support those affected by it. We also thank University of Pennsylvania for this opportunity. To our listeners, if you found this conversation insightful, please share it with your friends, family, or anyone who might want to learn more about FOP. And don't forget to subscribe to Cure Talks at 10 for more thought-provoking discussions on health, medicine, and rare diseases. Thank you, everyone.